Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And we've had a lot of questions from you. As I always tell you, this show is really your show. And, you know, you always talk to us about the three most talked about issues or questions are always pain, surgery, cancer, and really so that's 3A, and 3B is cardiovascular disease. So I wanted to bring somebody on who has got some real, shall we say, notches in his belt relative to the field of neurosurgery. And I asked Dr. Richard Foltz to be here, and he's a board-certified neurosurgeon. Doctor, how are you?
I'm fine today, Doctor. Thank you for having me.
Good to have you. And we have a very highly specialized individual by the name of Sacha Lovello, who is a nurse professional, baccalaureate nurse, may I say. And you are at the Spine Care Center, and you're the Spine Care Coordinator at Broward Health North. Correct. Just to let people know, Broward Health North is when you go on I-85 and you get to Sample Road and you look out there on the right-hand side, see that big building that's now being resurfaced and refinished. It looks glorified. It's wonderful. And really is the regional trauma center. And a lot of people are affected by it because most of South Palm Beach County uses it as a regional trauma unit. So, welcome.
Thank you. Thank you for having me.
Good to have you here.
Good to be here. Thank you.
Where were you trained?
I went to University of Pittsburgh.
University of Pittsburgh.
Yes,
they
sir.
have some great hospitals and healthcare facilities in Pittsburgh. In fact, we used to, in the state of Florida, we used to have a contract many years ago for liver transplants and other organ transplants with the University of Pittsburgh Hospital. That's before we grew up and matured, I guess. So, doctor, tell me about what's new in neurology or neurosurgery.
Well, the needs for neurosurgeons have grown, and the ability to provide care by neurosurgeons has diminished, unfortunately. We have dropped our numbers in the United States from at a peak around 5,500 neurosurgeons to now less than 4,000. And so that puts a great demand on our services. And of course, there's higher specialization, such as in my case. I have focused much of my efforts towards the management of spinal conditions, although in my long career here in Broward County, starting in 1995, I have treated children, adults, trauma. We've operated on babies. We've taken care of some of the best people in Broward County at our hospitals, and particularly at Broward Health North. And so the trends in neurosurgery are to focus your efforts as best possible and provide the services that you're best at. I would say what I have become better at in my long career here in Broward has been performing surgical interventions that are smaller and smaller. Now we have these really highly specialized treatments called minimally invasive spine surgeries, where sometimes the patients can have a life-changing operation and be home that same day.
Well, you know, I'm glad you brought it up, because the number one issue that comes to our phone and through our internet questions, or shall we say focus, is really on minimally invasive surgery. And the reason it is because, again, people are very, very cognizant of the fact that they want to diminish cutting, hospitalization, and pain. So in their minds, minimally invasive means, and whether it's actually that day or 28 hours or 36 hours, whatever it is, they equate to that, and they constantly ask us questions. So I'm glad you brought it up. Let's talk about the access of neurosurgical involvement and neurosurgery knowledge in saving lives.
Fabulous progress was made in the early 70s, and before I became a doctor, I was involved in research at Baylor College of Medicine, and we studied how we could improve the delivery of care for head trauma and spinal injuries, and how we could try and reverse paralysis, and a huge effort, of course, just locally down at the University of Miami with their center was one of the leading parts in the nation, but also in Houston where I worked, we had been exposed and did a lot of research. So the knowledge base built up. Fortunately, our government was able to support through the National Institutes of Health, for which I was a former fellow, and received a lot of grant money so that we could put really good efforts into the research. And so today, if I may brag just a moment about our facilities at Broward Health North, which I have been participating for now over 20 years, we have intensive care management of head trauma and spinal injury patients. We take care of stroke, which was a huge effort by all the doctors at the hospital. I was a small portion in developing one of the first stroke centers in all of Florida, which has now been recognized as a really stroke being a huge problem in the United States due to it's being more frequent in the elderly, caused by cardiovascular disease, one of our big issues. But not only do we manage all those advances, how I've specialized in spine and use all the services our hospital has developed, we created the first in Broward County, a specialized care center called a spine center, where every patient that we take care of conglomerates to be cared for by the same set of nurses. The operating rooms are specialized, and the access to these facilities has been streamlined so that patients can access us, use the services, pass through the hospital as quickly and as best services could be provided by our what we might call colleagues, our support staff with physical therapists, occupational therapists, our prime time nurses, cherry-picked, really great people. So that service has now been going on for quite a long time, and we're really very, very proud of it.
Good. You give me a segue to get to Sacha Lovello. May I call you Sacha?
Yes.
Well, thank you. Sacha, talk to me about the Spine Care Center, and really, it really equates to a lot of the things that Dr. Foltz was talking about. So,
Well, like Dr. Foltz said, we are the first and only certified spine surgery program actually in South Florida, and that's with Joint Commission certification. So we're very proud of that. And we coordinate care basically from the moment the patient makes that decision to have surgery through the whole process, including after discharge with follow-up.
and you work with obviously the neurosurgeons,
Yes.
and you obviously are vastly involved with the trauma issues and the trauma coordination, because, like I said, you're basically not only, I think you're level 1 or level 2, you're level 2 trauma center. Level 2 trauma center for the vast area of North Broward, going all the way out to the Everglades and beyond, but also South Palm Beach County. So you must have a tremendous impact on a daily basis relative to the unfortunate events of accidents, falls, I'm talking about car crashes and whatever it might be, airplane disasters, whatever it is that involves the very extremely capable, and I say extremely capable, and very finely tuned individuals that are in your center.
Correct.
So talk to me about who's in your center.
Oh, we have a really great group. It's a comprehensive program. Everybody works together to give the patients the best care possible. And that's the surgeons, myself as the coordinator, the nurses on the floor, physical therapy, occupational therapy, pain management. So we have a lot of resources that pull together as a team to give the best care possible for the patients.
My understanding is you have special certified nurse professionals, correct?
All of our nurses that care for the spine patients have training in taking care of the spine patients.
Are they certified in by certain organizations or things of that nature?
We don't have a spine certification per
Right.
se. They do for stroke though, yes.
And with stroke, I know, because as I was telling Dr. Foltz, I have a long involvement with one of his colleagues. I never say ex-colleagues, he used to work with him, but He's always, once a colleague, always a colleague. And that's Dr. Murray Todd. Dr. Foltz, tell me about, you were talking to me prior to the show about the number of certified individuals in certain areas. So go right ahead and talk about it.
Providing care to specialized conditions like stroke or spine requires a lot of extra training. General training like provided here at your medical school gets people ready for residency training, of which there are more than 50 specialties. But once you choose a specialty, inside the specialty, whether it's physicians or nurses, there are all types of subspecialties. And in the late 1990s and early years of 2000, your and my colleague, spoken of fondly, developed a program to assist the nurses in specialized training for certified nursing in both neurological and neurosurgical care. And at one point, we had the highest number of those specialists in the whole state. And they spread through all of the hospital, whether it's the emergency department, the first hour, the golden hour to treat these catastrophic conditions, or the subsequent care, such as in cases of aneurysm, where we have interventional procedures being performed which avoid brain surgery and treat the condition. We provide that. And then the nurses who provide the care for the patients from the entry to the exit of the hospital have specialized training for such, whether it be in the intensive care or the so-called stroke unit, which is a step down where patients who have made progress can get their transition, or our in-hospital rehabilitation unit at Broward North, where patients can then transition to a further inpatient rehabilitation. And having those specialized nurses who help all of the other nurses who may not have the certification but glean the knowledge from the leaders, it makes such a special circumstance that it's not duplicated elsewhere here in South Florida.
You know, it's an interesting thing, and not to get away from, but it involves neurosurgical intervention and nursing care, particularly the spine care center. We didn't have trauma definition and legislation in effect in the state of Florida until the late 80s. It's a blessing that we have in South Florida to be able to have these trauma units throughout South Florida to save people's lives. Because the people who are watching, who are kind enough to watch, really what they want to do is they want to have a quality of life. They're survivors. They live on. You talk about all the disease functions. We have the highest number of people in the age 70 and over of any state in the union. So what do they want? They want a quality of life opportunity. So you are, in essence, providing blessed services. So we appreciate it. Sacha, tell me about, I know that nurse professionals consistently go back and get specific training. Like I noticed that you are a baccalaureate nurse, so I would assume that you came through the traditional, you know, you were the two-year certificate nurse, and then you went through baccalaureate, correct?
Correct.
So talk to me about it for a little.
About my particular...
You can talk about anything. You want to talk about someone else, you could talk about someone else.
That's a big initiative, is to have all of the nurses go back and get their bachelor's and even advance on if they can and get master's nurse practitioners. As far as going back to the certification, we really encourage our nurses to get certified. Again, not specifically in spine, but a lot of our nurses are certified in neurological, which would be the stroke, and encompasses spine as well, or orthopedic certified, which does also encompass the spine patients as well. So we encourage our nurses to go back and get certified in either of those.
Well, again, I really think it's up to administration to, I guess I don't want to use the word entice, but maybe advocate. How about that? Advocate for your nurse professionals to not improve their service, but expand their knowledge base, because that's really what makes, for example, the spine care center and the trauma unit and the neurologic intervention units not only efficient, but much more capable, correct?
Correct.
it's really the nurse professional that provides anywhere up to 90% of the care to the patient.
Absolutely.
That doesn't in any way demean or denigrate the hard work that is being done by the physician, but the physicians, I believe, cannot function on a day-to-day basis in taking care of their patients both in the hospital and outside of the hospital without the nurse professionals' involvement. Do you agree, Dr. Foltz?
I couldn't agree stronger, but it's a team effort. And you, as a patient, might see a doctor for minutes in a day, where who's holding your hand or helping you to the bathroom, for instance, probably not your doctor. Although if I'm there, I'll be happy to throw a hand in. However, there will be a qualified professional right there to listen to you. Forget about the medical diseases. How about the mental aspect of being a patient or suffering in pain and having someone just to listen to you? That's the true benefit of having this team approach, because let me share with you, having spine surgery is not always painless. And at our hospital, with so many procedures being done, the focus on care of providing appropriate pain relief through either the use of intravenous or oral medications, that doesn't do it alone. You need the guiding hand of the helpers who are there, whether it be something simple like someone providing the meal at a timely hour, or the nurse answering the bell. Big focus in our hospital. It happens. So the physical therapist, scheduled times, let's get better, rah, rah. Do you understand? It's a team effort, and boy, do I know that firsthand. Excuse me. I get choked up with emotion because I myself had to have an operation, and having worked at essentially every hospital in the county, I chose Broward North. So just as an access point, I thought my care was super. I was a little scared, like any patient would be, and my experiences were fabulous. So I can't recommend enough how important it is that you have a good doctor, but they choose the right place if you have to have an inpatient hospital procedure.
Sacha, talk to me about your colleagues, because again, I'm getting back to this, because I know how your colleagues try to show to the entire family of healthcare the quality of your qualifications. Talk to me about it.
Well, we do definitely try to, it's a very much so a holistic approach, including the families, to give the best care to the patient possible. One of the things that we do is a preoperative educational class for all spine surgery patients, and we encourage them to bring family. So they come in prior to having surgery, and we talk about kind of what to expect before, during, and after the process. And all the staff, when they come on new that are going to be caring for our spine center patients, they come to the class also. So they see what the patient goes through, and they can bring it back to the bedside. And it's really is a holistic approach. It starts with education, but it trickles down to caring and being there for the patients and the families.
How was your, I think I know the answer, but I would like to come from your mind and mouth, and your interactive participation with the PT and OT folks.
Oh, we have it's a great team, a constant working together. They talk with the nurses that are at the bedside prior to seeing the patients. They give constant reports. We do interdisciplinary rounds on the patients as a team, and we include occupational and physical therapy.
Because most people don't realize the value of, and I know in neurology and neurosurgery, many people don't really recognize the importance of both the physical therapist and the occupational therapist. They have different metrics which they work under, not to abut one another, but to work coordinated and create a better outcome, and really what the doctor originally intends for the patient. Correct, Dr. Foltz?
Yes, it's so true. I wanted to mention to you another aspect of the center besides just the excellent teamwork, is that in our emergency department, which has been upgraded to one of the premier facilities in all of South Florida, multi-millions of dollars have been spent and years of construction. And as part of that project, we've developed state-of-the-art operating, something very near to my heart, state-of-the-art operating theaters where we have essentially every possible tool to deliver the most advanced care. And so really proud of that having taken place. That's been a very big effort. That took the entire political process, the money behind it. It's not easy to have money in the system anymore. There's so many outside forces that play. But not only that, I'm going to ask you if when you summarize with our wonderful hospital care, I want to talk in a few moments about our elderly population that we're so blessed with. They have specific disease processes. I wanted to focus just a few minutes with you, and then we can talk about how we deliver that care.
Now because we're down to the last
Fine.
4 minutes of the show.
Good. Osteoporosis, bad disease. It might affect 44 to 50 million Americans currently. It's terribly unrecognized, not always being evaluated, and unfortunately, it leads to spine fractures very frequently, perhaps up to 1 million this year in the United States alone. And it can happen all by itself or with a simple fall. And unfortunately, as we age, falls become more frequent. And osteoporosis affects much greater in the female population. So a nice lady has a simple fall and all of a sudden there's this horrific pain in the back from something called a vertebral compression fracture. And so that disease is not too hard to diagnose, and unfortunately the access to get in to visit with the doctor may understand, the primary care specialist as we might call them, might not have the x-ray facilities in their office, and then they have to send a patient out. If the pain is so severe that it's debilitating, incapacitating, that person probably has to visit the emergency department. And so not only the time and effort and the pain to go to the emergency department is recognized from our staff, but we have a specialized center that has something called fast track for very specific problems. Patient gets right in, sees the doctor in minutes, gets an evaluation and probably an x-ray, a CAT scan, or perhaps even an MRI study done, and we diagnose these conditions, whether the person needs to be in the hospital or they can come even back to a simple place like my office and treat these conditions, which nowadays has really come a long, long way.
Well, you know, we recognize that, and we also recognize that the hospital. We have a lot of wonderful hospital units throughout South Florida, and to tell you the truth, in the Jacksonville area, there are some tremendous hospitals in Orlando and Tampa Bay region. Not to demean anyone else, but there's a lot of wonderful hospitals. But the most important thing that I think has happened to hospitals is they recognize that you can't work alone. All right, and even the infrastructure, the ORs are now hybrid units. They're available for almost any situation that occurs, whether it occurs while you're in surgical technique or whether the cardiovascular surgeon's in technique, something happens. I think it's very important for people out there to realize that healthcare is responding. Yes. And that healthcare is now saying, we are not just one doctor in one subspecialty. We are a doctor in a family of doctors, correct?
Yes, with over 50 specialists, and those are easily accessed in our hospital. We have an on-call program. If your doctor works in our hospital, they'll come and visit with you there, or another substitute physician is immediately available. And we constantly do what's called consult our colleagues to bring them on the care to make certain that as fast as possible, every aspect of their medical condition can be treated, whether it's from diabetes with an endocrinologist or a cardiologist, or as we talked about, these minimally invasive surgeries, which started, of course, with operations in general surgery, but now led to us.
Okay, and Sacha, we're down to the last minute and a half of this show, and I just want to say that the Spine Care Center which you are the coordinator of, so therefore you're the boss.
Believe me,
Yeah,
I know that.
Yeah, you're the boss. So I want to congratulate you.
Thank you.
I want to say thank you because I know of all of the trauma care that you guys are presented to you, but also the due diligence that is necessary from the nursing profession in coordination with the super subspecialists and the subspecialists. So thank you very much for your hard work.
Thank you, Dr.
And thank you for being here.
Thank you for
All right?
having me.
And keep on educating yourselves. Very important.
Okay.
Thank you very much, Dr. Richard Foltz. And where can you be reached?
Well, it's quite easy. Just ring up the telephone at, we carry a BOCA number at 561-495-9511.
Got it. And we know how to get to you guys.
Correct.
All right? We'll put up the numbers for Broward Health North and particularly the Spine Care Center.
Thank you.
Just in case the people want to ask some questions.
Sure.
And folks, I hope we gave you information that's of value to you. You know, you asked about neurologic intervention, neurosurgery. So, this program is called Dateline Health. We come to you from Nova Southeastern University. And until next time, this is Fred Lippman saying, see ya.